Good afternoon, everyone. Joined by Director of Public Health, Dr. Mark Veach, Kath Morgan-Wicks, State Health Commander, and the Deputy State Controller, Donna Adams. Look, as I've said many times in this room, the safety of Tasmanians is of the utmost importance. It's been our singular goal since day one to ensure that we can keep people safe and healthy. Unfortunately, the COVID positive man who absconded from hotel quarantine has not been cooperative, leading to inconsistency and non-disclosure of information. Unfortunately, it took 2 days to verify that he was at the Woolies, and with growing concern now that he has had in fact several touch points within the community. We can't continue to wait another 2 days to find out more about what's been going on. Additionally, a further primary contact of the man in the northern suburbs breached home quarantine last night. He has been apprehended and fined, and he's now been placed into a government hotel. Now, prior to reaching our vaccination goals and in readiness to open our borders before Christmas, we simply cannot afford for an outbreak to occur and to put the health and safety of Tasmanians, and especially the health and safety of vulnerable Tasmanians, at risk whilst we get our vaccination rates up. We're at a crucial stage of the vaccination rollout, and with a plan to be open before Christmas and to hit those vaccination rates, we need to ensure that we can continue with that. Therefore, on public health advice, as a result of the circumstances that we now face, there will be a 3-day snap lockdown in southern Tasmania. This will commence at 6 p.m. tonight and be in place for 3 days. It'll end at 6 p.m. on Monday the 18th, subject to public health advice at that time, but obviously we will keep you informed over coming days. The lockdown in southern Tasmania will include the local government areas of the Brighton Council, the Central Highlands Council, the Clarence City Council, Derwent Valley Council, Glamorgan Spring Bay Council, the Glenorchy City Council, Hobart City Council, Yuan Valley, Kingborough, Sorell, Southern Midlands, and the Tasman Council area. Other areas of the state at this stage are not in lockdown. Regardless, I would say please remain vigilant and get tested if you have any cold or flu symptoms, no matter how mild. Also, if you're outside the lockdown region, then please do not travel into the areas that are locked down unless for essential or emergency reasons. From 6 p.m. tonight for the next 3 days, there are only 5 reasons to leave your home. Shopping for essential supplies such as food, beverages, fuel, medicine and health goods within 5 kilometres of your home or closest store. To go out to undertake personal exercise outdoors alone or with members of your household or one other person for safety reasons, once per day for a total of 2 hours only and within a radius of 5 kilometres from your home. You can go out to attend medical or healthcare appointments, including to be tested or vaccinated for COVID. You can go to work if you're a permitted worker in the businesses that will remain open over the course of the 3 days, or you can go to school on Monday if the child of a permitted worker or if the child cannot be supported to learn from home. But otherwise, you'll stay home from school on Monday. Other permitted reasons will be allowed, including, and these are matters that we have learned from past experience, seeking veterinary services for animals, attending childcare, or providing support or care to a personal custody or parenting arrangements. To understand what the snap lockdown means for you, your family or your business, please visit www.coronavirus.tas.gov.au. In terms of gatherings, and I'd encourage people to go to the website to get this information. Indoor and outdoor gatherings are not allowed. There are no more than 10 guests at a funeral, and importantly, no weddings unless for compassionate reasons over the next 3 days, and then only 5 people would be allowed. In terms of visitors to homes, there are no visitors to homes unless they are supporting a vulnerable person, visiting as part of a significant relationship, or visiting as part of a visitor bubble with someone who lives alone who's not in a significant relationship for support purposes. Regarding business restrictions, there are businesses permitted to open with a COVID safety plan, businesses that can open with restrictions, and businesses that will be closed. And again, the information is on the website, but I'll provide some examples. Cafes, restaurants and hotels can open for takeaway only. However, places such as day spas, beauty parlours, gyms and hairdressers will need to close over the next 3 days. Supermarkets will be open. However, non-permitted retail businesses such as clothing or homeware stores can provide contactless collection and delivery of urgent household supplies only. Construction, both civil, residential and commercial, will be shut for 3 days apart from for emergency needs or repairs. Hardware stores such as Bunnings will be shut apart from allowing tradespeople or those who have an essential or emergency need. Face masks must be worn apart from in your own home and will be required indoors and outdoors for the next 3 days. Visits to aged care and hospitals are restricted, including the number of visitors and visit frequency and length, and again, information is on the website, and Catherine Morgan-Wicks might provide more information there. Regarding travel to Tasmania, Tasmanians who are currently in New South Wales, the ACT and Victoria, noting the challenges that they have and the fact that people would need to quarantine if they arrive here, will not be permitted to return to southern Tasmania during the lockdown period. Returning Tasmanians and other travellers from low-risk locations such as WA, South Australia, Queensland and the Northern Territory who have travel booked to return to Tasmania in the next 3 days, you can return home, but you must enter lockdown and be in lockdown for that period of 3 days. When you arrive, travel directly to your home without making any unnecessary stops and wear a face mask. You must remain at home during the lockdown period where possible, consistent with the lockdown rules. Be prepared to work from home, study from home and only leave the house when absolutely necessary. I want to confirm, however, on Monday, noting that university and some, I think, Year 11 and 12 exams may be taking place, that those exams will be able to take place, but obviously under COVID rules. For non-Tasmanians that want to travel to our state, if you're not a resident, we encourage you to reconsider your travel to southern Tasmania whilst the lockdown is on. For people here who are wanting to leave Tasmania over the next 3 days, please check the jurisdiction where you're going to and make sure that they will accept you. If you decide to leave Tasmania, you must wear a face mask whilst you travel to the airport or seaport, obviously, and travel there as directly as possible without making unnecessary stops. Tasmania Police will be establishing roadblocks and undertaking compliance activities during this period, and penalties will be in place if people are found to be deliberately not complying. In terms of business support, I want to stress to Tasmanians affected by the mandatory stay-at-home orders that there is support available through the $1,500 pandemic leave disaster payment for people who can't earn an income because they must self-isolate, quarantine or care for someone who has COVID. There is also the pandemic isolation grant available, which is $250 per adult, $125 per child, capped at $1,000 per household for those that would normally be working and can't. We will make that available whilst needing to be tested or isolating. For information on those grants, please call 1800 671 738, and obviously we will continue to liaise with business community and anyone else affected as we work our way through this. Now, it's natural that a lot of people are going to have a lot of questions about this. We know this from past experience. If you have access to the internet, I'd encourage you to visit the coronavirus website. And again, I'd make the point www.coronavirus.tas.gov.au for current detail. We'll continue to provide daily media updates over the 3 days and, if necessary, more regular than daily if need be. You can also call the Public Health Hotline on 1800 671 738 for support and advice. We are upscaling the capacity of the hotline as I speak, but please be aware that they will prioritise calls from those impacted by contact tracing and seeking immediate support. So if you can't get through immediately, please be prepared to call back later if your query isn't urgent. And in conclusion, I'd make this point. We might get to Monday evening at 6 p.m. and we may see no more cases. we may get to Monday evening at 6 p.m. and we may see many more cases. One of the things that we do not want to be in this state is either Sydney or Melbourne, who acted too late in both instances when dealing with Delta. We have a circumstance now where we have a positive Delta case in the south of the state with contacts that we are contact tracking and tracing, but unfortunately the information that we have around those people has been difficult to gauge. We are receiving reports from the public in terms of touch points in the community that individuals may have attended. It is important that at this point in time, as we cannot be certain about the information that we have, that we ensure that we take every step that we possibly can to ensure that the state doesn't have a Delta outbreak of scale that would impact on this community and then on our broader state community before we are in a position that our vaccination rates are much higher. So with that said, I'll hand over to Dr. Veitch, who will provide further update.
Thank you, Premier. I'm disappointed to be here sharing the conference with Premier, the Deputy State Commissioner and the Health Commander to bring this news to you. However, as the Premier has said, we have always been ready to go into a short, sharp lockdown to mitigate risk to Tasmania. And I think that as we are now, this moment, we are at the highest risk of having COVID transmission established within our state at any time this year. And that's why we've acted to announce the lockdown. I'll provide you with a little bit of background and a few extra details, but the process of the lockdown is relatively detailed and it'll all be available on the website. The key points were just put to you by the Premier. So this relates to a case of coronavirus, a man who came into the state on Monday night and was confirmed as having coronavirus on Wednesday morning after an equivocal test on Tuesday night. So this person spent around 18 hours, we think now, in the Tasmanian community. This time yesterday, you would have heard that there were a number of primary close contacts. There's 39 of them now we've established. These are the people with the closest contact to the case, and include the people in two households and some friends, the flight, and some people involved in the arrival of this person into Tasmania and also their return to quarantine after leaving it. Those 39 primary close contacts are the people who are at highest risk of catching COVID from him. We have 17 of those people with their early tests back negative, and we expect we'll get most of the remaining 22 results back later today or tomorrow. So these are tests done fairly early after contact with the case. We do an early test in these people in case we can pick up the disease early, but we also do tests later in their quarantine. We also have 19 casual contacts whose test will come up over the weekend. And that's where we were yesterday. But during the morning yesterday, we heard that this man had spent time in Woolworths. It was presented to us as information from the community. It wasn't verified. The Premier noted that we have had difficulty in getting clear, consistent and true information from the case, and indeed from some of the contacts of the case. We've got stories that don't disclose all the information, so it's been a very difficult contact tracing exercise. When we get information from other sources, we need to verify that information because when you do these investigations, you do get lots of accounts from the public about what cases may have done, and you have to follow them through with some kind of verification. So we used closed-circuit television footage to be able to identify when this person was at Woolworths on the Tuesday afternoon, and that was between 3:30 and 4 o'clock on the Tuesday afternoon. We verified that with that footage yesterday evening, and within an hour or so we had that on the website to alert people to the fact that that was an exposure site. So far, around about 80 people have been identified who were at Woolworths in the half hour that the person was there. All those people are being assessed, and they'll of course become contacts. It is a reason for concern because we're now 3 days after those people were at Woolworths at the same time as the man, and that gives time for the infection to develop and become infectious for other people. So it's that sort of concern about risk that is influencing the advice to go into a lockdown. We have also identified that this person was at Montrose Park late Monday night. That's shortly, some while after leaving the hotel, and they were there from around about 11:30 up until about 1:30 in the morning. So that's also an exposure site, and we've asked people to come forward if they were there in that park then. Another thing that's occurred is Kath Morgan-Wicks will shortly tell you about the testing initiatives. There's a lot of testing happening now at the moment in the northern suburbs of Hobart. We've also heard of people who've come forward for testing who said they thought they'd been in contact with this case at some time when they're in the community. So it's that sort of information that we get that gives us cause for concern and leads us to this decision to recommend a lockdown. Just to give you a little bit more of the rationale behind the lockdown, why should we do it at this stage of our progression through the COVID pandemic? Well, there is some national advice that's been developed on the sort of situations in which it's advisable to do a lockdown to manage COVID, even as we start to vaccinate a large proportion of our population. And the sort of things that prompt a need for a lockdown if we have evidence that there's been a delay in getting in touch with contacts. And I explained to you that from the limited and sometimes false information we've had, that's been an issue for us. Those 80 contacts from Woolies are the example. This is also occurring in a community that is relatively less vaccinated than most of Tasmania, so that also increases the risk of infection being spread within that community or quite quickly beyond that community. And that's been seen in a number of communities around Australia, in Western Sydney, in parts of inner Melbourne and parts of Canberra. There have been outbreaks of coronavirus infection that have been very difficult to control, that have occurred in relatively less communities and often in relatively disadvantaged communities. That's another cause for our concern. And I think the other really important point to just emphasise is that we're getting close to, I wouldn't call it the finish line, but we're getting close to achieving very high levels of vaccination. We haven't achieved it in the Brighton local government area to date, and we want to promote that. But we want to get to the point where all of Tasmania has had an opportunity to get vaccinated, been vaccinated, and makes it much harder for the virus to spread. And that's why we want to aggressively tackle this risk of coronavirus spread so that, as the Premier said, we would be very happy to stand here on Monday and say, after this, we acted quickly because we saw a significant risk. We haven't had any cases. That would be a great outcome for Tasmania. So I do hope that we're here on Monday and able to say that. The Premier has mentioned a number of things about the requirements of the lockdown and the reasons why you can leave home, and these include shopping for urgent supplies within 5 kilometres of your home, attending medical and health appointments, including getting tested and getting vaccinated. If you're a permitted worker, and the list of the permitted workers and permitted services and premises that can operate during the lockdown are listed in the on the website. You can leave lockdown to go to school if you're the child of an essential worker or you're unable to learn at home. And I should note that there are Year 11 and Year 12 exams coming up next week, I think some of them on Monday, and university exams. Those late secondary and tertiary students will of course be able to attend their exams in COVID-safe conditions, and you can exercise once a day within 5 kilometres of your home with either another single person or someone from your household. The other two things just to mention is that People will need to wear masks whenever they're outside of their home, unless they have a medical exemption or other reason for not wearing a mask, or they're aged under 12. And the businesses that are permitted to operate, most of them will be required to abide by a density limit of not more than 1 per 4 square metres in their premises. We've been operating at 1 per 2 square metres, so from while the lockdown's in place, people will be required to have people in their place at no more than 1 per 4 square metres, so that will limit capacity in some premises. So I might just leave it there.
How confident are you that this will be a 3-day lockdown only?
I'm not going to predict whether this will be only a 3-day lockdown. I think we have, there are some encouraging signs in that we haven't had any cases amongst amongst contacts so far, but we're getting an increasing number of contacts. What we'll be doing over the next couple of days is obviously evaluating the situation day by day, but what we'll be looking at carefully on Sunday is the outcome of the contact tracing. How many contacts have we found? How confident are we by Sunday that we've identified all the places that this person could possibly have been? So I expect we'll find ourselves verifying other accounts from the community about where this person may have been. Obviously, it'll be important to see if we've seen cases amongst the people who have identified contacts. It will be even more worrying, and I certainly hope we don't, find cases amongst people who don't have an obvious connection to the case. So it's those sort of findings, and also whether the situation with the close contacts, who by that stage will be about 6 days past their exposure, the information that we get from their test results will also be very important.
Do we know for sure that this is the Delta strain?
And this gentleman does have a Delta strain infection, yes.
So just to be clear, at this stage, public health isn't aware of any other cases either in the community or in quarantine in relation to this man? We're
not, and that's what we're doing. We're encouraging people to get tested if you're in the northern suburban Hobart, and there's been a lot of people coming forward. Anybody anywhere in the state could get infected. So, but the risk is probably mostly confined, we think, to the southern part of the state. We think it will probably be disproportionate to apply lockdown measures more broadly than the southern region. But as I pointed out, we're now 3 days since the time this person was in Woolworths, so people who had potentially got infected in that situation could have moved around Hobart or into the nearby local government areas.
How many people do you have working on contact tracing at the moment?
I don't have the number off the top of my head.
Can you give us a roundabout?
I'm not going to make a guess. We have the team's busy, but they're working through it.
How do you deal with, I mean, obviously you hope that most people are going to be cooperative when they have COVID-19, but when you don't have a cooperative person, what do the contact tracers do?
Well, our contact tracers are doctors and nurses who've got clinical backgrounds, and they're used to engaging with people in difficult circumstances and people with illnesses and bad news. They usually take an approach of matter-of-factly trying to get information from people about where they've been and what they've done, and that usually provides us with the information that we need. In this situation, we got information that was incomplete, so people try interviewing people more than once if they're cooperative, and we, in some circumstances, will talk with other people. We'll talk to some of their contacts. If they have given us some contacts, we may talk with them about what they knew the person was doing and get variable amounts of information from doing that. And sometimes we have to turn to other sources such as closed-circuit TV to see if we can see the movements of people or identify them in certain places.
We had lockdowns last year. We're now pushing up towards 70% double dose vaccination rates. How does that make our situation different?
We're going to get to a situation where we get 90% or so of the population eligible population vaccinated, and at that point I would not expect that we would need to have lockdowns of this character. But at the moment we know that the vaccination coverage in the area around Brighton is, I think, around 50% fully vaccinated and about 60 to 70% one dose, but it's considerably lower than the rest of Tasmania. So we're concerned that both the overall Tasmanian vaccination coverage is not high enough to relax our measures, and more particularly we're concerned that the area where this case has been moving is certainly not high enough to prevent spread in the community of the Delta strain. But as we get closer to 80 to 90% of even coverage across the state, lockdowns are less likely and may be done more lightly, if you like.
Whose fault is it that we're in this position? Is it the government's for letting this man get out of quarantine undetected, or the man himself?
I don't look at this from the point of view of finding fault or blame. That's no way to get out of COVID. We're never going to get out of it that way. The team that I've worked with has worked tirelessly over the last few days, at times with limited cooperation from these cases, but in spite of that, they've tried alternative ways of getting the information that we need to take the action to protect Tasmania. So we've tried our best, used alternative mechanisms all along, and as I've explained, as soon as we get information that is verified and that we can act on, we go for it. We put the information, make the information public. So we did that last night within an hour or so of confirming that Woolworths was a site, and we've done so similarly all along. You can't work with unverified information. It's tremendously disappointing if we get false information or undisclosed. People don't disclose it. It puts all of us at terrible risk.
Yesterday afternoon, the ABC got in contact with Public Health to inform them or ask about a report that the man had been at a supermarket in the day before or 2 days before. I think that was before 4 p.m. Why did it take so long to and we were told that Public Health was already aware of reports like that. Why did it take so long to verify the information?
Because we had to work through closed circuit television of Woolworths. And that takes hours to do.
When was Public Health made aware of the Montrose Bay exposure site?
I think we became aware. I think we confirmed it this morning. I think we became. We were able to be sure of that.
Because as far as I can tell, it's only gone up on the website this afternoon. So why was there that delay?
Look, I can't speak of that operational detail, but we obviously put it up there as, whenever we're confident that we have information that's correct, we send it off to our web management team and they put it up. So we don't hang around, sit on that information. We put it out. We put it up before we even go off in public with the presser.
Did the COVID positive man tell you about that exposure site, or did you have to find out through another member of the public?
I believe we found that out from an indirect means.
The mere rumour of a snap lockdown saw people flooding supermarkets just earlier. Why did you decide to stick to the 2:30 presser instead of perhaps allaying their fears and talking to the public a few hours ago?
Preparing all of the legal instruments and checking that we've got all the messaging right, checking that the key stakeholders who are affected by a lockdown are informed, takes a couple of hours.
Do you think you should have revealed which suburb this man was in a little bit earlier?
I didn't reveal the suburb that he was in out of minding the privacy of the case. I don't know that it would have, I don't believe it would have helped to have provided that information any earlier, but now that we do know that there's been community risk in that area, we've made it immediately public. And of course the other thing I should point out is that while Bridgewater is the focus of this, the people who went to the Bridgewater supermarket could have come from Taroona, could have come from, from New Norfolk. So we do need to be mindful that an undue focus on a particular area might prevent people who are at risk from other places from coming forward.
Do you believe that our
vaccinated?
I'm not going to provide the information about their vaccination status.
Is there a reason why?
Because it's their medical information.
Do you believe that our contact tracing system is fit for purpose, given the situation with an uncooperative person?
We have I think it's a tremendous contact tracing system. It's a team yesterday who I acknowledge for their skills and their dedication. And in this situation, when we were unable to use conventional contact tracing to get the information we needed, we had great support from colleagues in the police who work with us and help us work through closed circuit TVs and use these other methods. And you know, within an hour or so of confirming that this person had been at Woolworths, we'd identified 80 or so people who'd checked in there, and we had sent them all SMSs alerting them to their possible risk. So all that timely response and finding other ways of getting critical information is, I think, a testimony to their skills.
I believe the current staffing and current system of contact tracing is fit for purpose when you have an uncooperative person.
I do, yes.
Okay, thank you.
It's difficult.
Thank you, Dr. Veitch. So I want to assure people that if you need to get a COVID-19 test or get vaccinated against COVID-19, you are able to do that during the lockdown period. The Department of Health has significantly increased resources in testing and vaccination in the southern region today and over the coming days to support the increased demand. We encourage everyone in the community with any cold or flu-like symptoms, even mild, to come forward and get tested for COVID-19. Symptoms include fever, runny nose, cough, sore or itchy throat, and shortness of breath or loss of taste or smell. If you are concerned, get tested and remain isolated until you receive your negative result. Importantly, even if you are vaccinated, you need to get tested if you have symptoms. This weekend, mobile testing will be located at the Chris Fitzpatrick Memorial Park, Tottenham Road, Gagebrook. Testing will be available between 9 a.m. to 9 p.m. No bookings are required, just turn up and get tested. I also remind everyone that testing is available at the Macquarie Point Testing Clinic at 16 Evans Street, Hobart. We have extended opening hours from 9 a.m. to 9 p.m. To book a COVID test at Macquarie Point, please call the Public Health Hotline or go to www.coronavirus.tas.gov.au and select Testing for COVID and select Register Online. We will then call you with a test booking time, so please make sure that you answer the phone. We are seeing significant demand at the Gagebrook Clinic today, and we have been redirecting people at the end of the queue to Macquarie Point. And we really do appreciate everyone's patience. And for those of you sitting in cars right now, we will be open until late tonight so that you can be tested. We are also working to bring a third southern site on at the Derwent Entertainment Centre from tomorrow, and we'll push out messaging later today with the opening times for that testing clinic. If I go to vaccination clinics in southern Tasmania will be open from 9 a.m. to 9 p.m. during the lockdown period. You can make a booking, or if you don't want to wait, or you can walk in. Our key state vaccination sites today and over the weekend in the south are Bridgewater at the Brighton Civic Centre, Greenpoint Road Esplanade today through to the 18th of October, PW1 in Hobart today through to the 18th, Moona at Your Church, 29 Charles Street today through to the 18th, and we have a new vaccination site at the Goods Shed at Mac Point next to our testing clinic, Saturday and Sunday, which has just opened up bookings. We have Mona at Berrydale on Monday the 18th of October from 9 a.m. to 5 p.m. We have Ooze, Central Highlands Community Health Centre, Monday 18th of October, 9 a.m. to 12 p.m. and at New Norfolk at the New Norfolk District Hospital, Tuesday and Wednesday from 9 to 5. Now, if you're booked in already for a dose 2 or a dose 1 at any other clinic that I haven't listed, please make sure that you do show up for your booked appointment. In terms of hospitals, during the lockdown period, visitors will be restricted at southern Tasmanian hospitals. No visitors will be permitted to enter hospitals except on compassionate grounds and as listed on our hospital's website. We ask that everyone please respects the directions of our hard-working hospital staff and ensure that they comply with these restrictions. For anyone that has a GP appointment, an outpatient appointment or an elective surgery or any other hospital appointment, these will all continue as these medical appointments are allowed under the lockdown directions. Now, there are some restrictions on some health services. So, for example, dental, which will only be open for particular emergency dental treatments in both public and private, and these will all be listed on our website. Additional screening will be occurring at our emergency departments, so please do be patient. For aged care and residential aged care facilities, there will be no visitors except for compassionate reasons, for end of life or for dementia, to ensure that we do reduce stress or confusion for those types of patients. And masks will be required at residential aged care facilities. In terms of face masks, the Health Department will utilise some of its stockpile of face masks to make these available to people that are unable to access a face mask, and particularly those in our northern outer suburbs. We are pre-positioning additional face masks at our vaccination and testing clinics, and will work together with local councils and peak groups if it's needed to further distribute those masks. So overall, we are currently constantly reviewing the current situation and will continue to do so through the lockdown period. Our priority is to continue to deliver services to the Tasmanian community, as well as additional support that people may need, including testing and vaccination services. And people can please be assured that additional resources are being immediately deployed to ensure that waiting times are minimised. All of our health services are continuing to operate, and all of our health personnel are permitted workers and able to attend work to ensure that the community's health needs are met. And if you do need support due to feeling anxious or concerned, please contact a Tasmanian Lifeline on 1800 984 434, which is open 8 a.m. to 8 p.m, 7 days a week. And please, if you are not vaccinated, please attend one of our vaccination sites or your local pharmacy or your GP and get vaccinated today.
The northern suburbs want to get tested but they don't have access to a vehicle. Are there options for them that you could suggest?
Yes, they should ring our public health hotline and let them know that they have a transport difficulty, and we will make arrangements for them.
People may rush to get tested, but you don't actually become protected at the moment it gets put into you, do you?
People may rush to get vaccinated?
I mean vaccinated, sorry.
So we really do encourage people to get vaccinated as soon as possible. So you do receive full protection from vaccination once you have received both doses of the vaccine. So it is important that people do get dose 1 of a vaccination as soon as possible.
What was the wait time for the Gagebrook testing facility earlier today?
So earlier today we were reporting wait times of over 1 hour. I haven't got the current wait time at the moment, but we did deploy officers to the end of the queue to actually shift them to our Macquarie Point site that had further capacity.
Questions for Don Adams?
Yeah, I've got a couple. One, maybe. Just following up on a couple of questions from yesterday, is it still the case that this man has just received the 2 fines and no other charges or fines?
No, the man has received 2 fines, as we've previously discussed.
And is there any update on the person that helped him leave the hotel, if they've been fined at all?
As he indicated yesterday, this is a public health response at the moment, and once that response is concluded, Tasmania Police will make inquiries to identify whether there needs to be any additional charges to the person that helped the man leave the quarantine hotel.
Do you believe the fines are sufficient enough?
The fines have been increased. As we started the pandemic, we had a $778.50 fine, and that's been doubled, and I think that's appropriate.
Do you think that police, though, would look at further infringements or other penalties for people like this 31-year-old man who's been not complying? Do you think it's appropriate that police would ramp up those measures?
Police will investigate the breaches as they occur, and they will, enforce those laws as they are described.
We were told there was another primary contact who's breached quarantine. Has that person been dealt with?
Yes, we had a male that was located last night not complying with their quarantine requirements, and that person received a fine.
Generally, the public have been very compliant with directions around lockdowns and the like. What can people do to assist police over the weekend to make this as orderly as we can?
What we would like is for Tasmanians in the 12 local government areas to limit their movements over the next 3 days, to comply with the requirements that support the lockdown. Please make aware of what those requirements are. As the Premier and the Director of Public Health have indicated, those requirements are listed on the website. Be familiar with them and please limit your movements. If you don't have to leave your home, please don't.
Will police be stopping people and asking where they're going if they're on the road?
Yeah, police will have a very high visibility presence over the next 3 days. We will have people at the boundaries of the 12 local government areas, and we'll also have a number of high visibility patrols throughout those local government areas.
Is there a likelihood you could cross a boundary unintentionally, or will there be police at every possible point?
Look, police will obviously, they will deal with the circumstances as they present, and if there's an educative approach that needs to be taken, we'll certainly take that. But where there's a deliberate flouting of the law, police will take action and issue infringements.
But other close contact who breached their quarantine, how did police find out about that?
Police conduct a number of compliance checks for those that are in home quarantine, and that person was detected not at home as part of those compliance checks.
And just to clarify, are you permitted to have a person that you might be in a relationship with to come and visit you at home?
Yes, you are.
Questions for the Premier?
Thanks, Don.
The entire state's been plunged into lockdown because of the actions of one person. How angry are you with that individual?
Oh, well, look, to be frank, I think their behaviour's been outrageous. We have done everything that we possibly can to keep Tasmanians safe, and in the main, Tasmanians have worked with us and have done the right thing, and we have had one of the longest runs out of any jurisdiction in this country in terms of increased restrictions or lockdowns. It is very, very disappointing, the circumstances that we find ourselves in at the moment.
This is obviously going to cause a lot of hardship, not just for individuals but also for businesses. Will the government look at new rounds or fresh initiatives to assist businesses who are going to have to close?
Look, obviously a number of businesses will still be able to trade through takeaway through this, and there will be some businesses that will not be impacted much at all. But what we will do is work with the business community, and as I've always said, if there is a need for us to do more in terms of support, we will.
More than 18 months to focus on getting contact tracing up to scratch. Should we be better equipped to deal with uncooperative people?
Look, I'm not sure what you would like us to do with uncooperative people, and I heard your questions to Dr. Veach. If somebody doesn't want to tell us the truth or doesn't want to speak to us, it's very difficult to force them or to compel them. That is just a statement of fact. Now, what we've got is an individual here who has been very unhelpful, has not been cooperative, and in fact, to be frank, we're not certain whether we're being told the truth or not, which is why we've taken this action. But again, it's very difficult to compel an individual that doesn't want to tell you the truth to tell you the truth.
I guess I'm not asking if there should be different means of dealing with the individual, but whether we maybe could have gone via other means once the contact tracers realised that he was being uncooperative. For example, neighbours in one of the Bridgewater streets yesterday said they hadn't heard anything, but they seemed to have things that they wanted to say about, seeing him at the supermarket and that sort of thing, but they hadn't spoken to any contact tracers.
Well, in that case, look, I would hope that people would feel comfortable getting hold of the 1800 number, letting Public Health know, my office or another member of the government. There are many avenues that people could reach out and let us know if they've got information. And I would encourage people over the next 3 days that if they have concerns or information that they are aware of, that they bring it forward. What we want to do is to keep people safe. It's unfortunate that we are in this position, and I have to tell you that it's been a very difficult decision today to make. But we saw what occurred in Melbourne and Sydney, where they acted too late, and with Delta, if you do that, then it gets away from you. And again, I think Victoria are dealing with more than 2,000 cases again today, of which it's a statement of fact, some of those people will die. We don't want to be in that position in Tasmania.
If we do see further or if we do see cases emerge over the weekend, do you think it's likely then that the 3 days will be extended?
Look, I won't deal with hypotheticals on that. Again, I'll rely on public health for their advice in terms of that. I would hope that this 3-day snap lockdown does the job, that it enables us to, with confidence, reopen on Monday at 6 p.m. But if circumstances change, obviously we'll be in this room and explaining those circumstances.
Has the review of the travel lodge found anything yet about how the man was able to leave?
Well, look, I'll share what I know at this stage. I don't have the final picture on this, but there are 2 ways that person could have left the room. One is through the window, one is out the door. It's a possibility that they could have gone out the window in terms of where their room was and where it was placed. The other issue is that in terms of leaving through the door, there was a guard on every floor. There was a short period of time, I understand, where the guard went into an ante-room to remove their PPE after returning the person to their room, and the person may have left via the fire escape. But neither of those matters, neither of those 2 routes have been confirmed as yet, but they are the only 2 options that are available. Again, we put in place different sets of rules now in terms of dealing with people that are being placed into hotel quarantine who've arrived in the state, and there are very few of them that have arrived in the state without a good to go pass.
So are you already, at the travel lodge and at other hotels, are you already addressing the issue of guards leaving and going into other rooms to change their PPE?
There are more guards at the travel lodge now. We're reviewing our other hotel circumstances as well, and in terms of closed circuit TV and other electronic monitoring, that's also been upgraded as well.
This lockdown's obviously quite extensive. You mentioned that Glamorgan Spring Bay is one of the LGAs included. What would you say to people who might think that's a little bit too extreme?
Well, look, one of the things that, and I would say to people today, right now in Hobart, that have been watching this, if you have a shack in Glamorgan Spring Bay or on the East Coast, please don't leave Hobart. This is one weekend where you should stay at home. But as Dr. Veach has indicated, more than 80 contacts in that supermarket, and in Tasmania, I think we all recognise with the degrees of separation that many people come into contact with others, and right now we could have a case in Glamorgan Spring Bay. We don't know. That's the challenge and the issue that we're dealing with.
And usually this lockdown seems to have been leaking out since about mid-morning, and we've seen panic buying. What's your message to people who are concerned that they haven't got enough toilet paper or they haven't got enough food to get through to Monday?
Look, supermarkets will remain open. There is no need to panic buy. There will be plenty of supplies on the stocks, on the shelves. Just be sensible. End of the day, there is no need to rush out and panic buy. But I do want to say this as well. Just in terms of this circumstance, I am sorry that we are in this circumstance. But we have had an individual that has been very difficult to deal with, that has not done the right thing, that has broken the law and has not been prepared to tell us the truth. And what we're finding now is that as we progress, the risk to Tasmania, as Dr. Veach has said, right now today, we believe is higher than what it has been at any other time this year in terms of an outbreak. And so we're taking this step to ensure that we don't see that occur.
How do you anticipate the WWBL matches this weekend to be affected?
Look, in terms of that, we're currently working through it. If they do go ahead, bearing in mind that there are national and international matters to consider here in terms of the broadcast. If they do go ahead, they would go ahead with no crowd and with the players remaining in a bubble.
And the Unconformity Festival, do you imagine this will impact that?
Look, at this stage, my expectation is that that will still go ahead, but I do want to touch on that tyre fire that has occurred there, and I understand that the authorities, the TFS, are working very closely in getting that matter under control. It's been very distressing, as I understand it. There's been a significant amount of smoke, but at this stage, I expect that that will be brought under control, and in terms of unconformity, I expect that will go ahead.
Just one on the New South
undertaking
Wales borders,
vigorous exercise. If people are undertaking vigorous exercise like cycling or running, do they also need to wear a mask?
Look, that's a question for Dr. Veach. In terms of wearing it whilst exercising.
I have to check the direction. I think we give dispensation for vigorous
is opening its borders to fully vaccinated international arrivals from the 1st of November. What are your thoughts on that, and would Tasmania do something similar in the near future?
Well, in our case, we're working through those vaccination target thresholds, 70%, then 80 and then 90 by the 1st of December, which is our target date. Now, as I've said, I would hope that we would be open in terms of our borders by Christmas. And one of the key reasons that we are doing what we're doing right now is to ensure that we can not disrupt the vaccination program that we have underway, that we don't disrupt ensuring that we have as many Tasmanians as protected as possible as we work our way through this. And so in terms of returning overseas people, what we would do is apply our normal border arrangements as they were in place on the 1st of during November, when the New South Wales changed their rules. But then once we reopen our borders, we'd obviously reassess it then.
Organisers of the Unconformity Festival have actually just posted to Facebook saying that they're cancelling the event and encouraging everyone who needs to go inside, stay indoors. Is that disappointing to hear, and what's your message to those organisers?
Well, look, that is a fantastic event, and one that the state government has supported very strongly, and so I'm very sorry to hear that that is not going ahead under the circumstances. But as I say, my current advice was that there was nothing that would preclude it from going ahead, but obviously on the ground there may be other factors that have been taken into account.
Is there any instruction for people who've been in any of the lockdown affected areas that have since left and might have gone away, for the weekend, or?
Again, monitor themselves for symptoms. I think would be sensible, and again, anybody that's concerned should contact the public health hotline.
Is it possible to say, probably it's technical questions, probably get a copy of the directions, because it'll probably be Monday before it's gazetted?
The directions will be online very soon today, and I can just confirm that it's vigorous physical exercise that you are allowed to take your mask off.
Thank you.
And in terms of the lockdown plan, it is broadly in line with the plan that I released only a handful of weeks ago. The only change of any significance is in terms of the examinations on Monday for any university or Year 11 and 12 students, and they will be going ahead.
We probably should ask also, does this affect the plans for the release of the modelling next week? Is there any interplay between that and the likelihood of our borders?
Look, I would hope that we would lift this lockdown on Monday at 6 p.m, and as long as our staff aren't engaged in other matters related to this or its aftermath, that we'll be moving forward and releasing that information at the end of next week, as I've already proposed. If there is to be a change to that, I'll certainly advise you over the weekend.
Thanks all.